In 2010, we had a new constitution as a country in Kenya, and one of the biggest pillars of this constitution is public participation. So private equity firms and pharmaceuticals and other non-state actors have an opportunity to engage with government. The way we engage with private entities has changed. We are trying to make doing business easy in Kenya, that's one. And two, we have realized that we can have a win-win situation. We have objectives as government, and the private entity comes with their objectives. So how can we be able to integrate both our objectives for the win of the patient? So that's one. Healthcare systems, as Ministry of Health, if I may speak from Ministry of Health, we can't pretend as government to be able to solve all the problems. So we require the private companies and private equity to inject some capital as they make their business. We also are able to meet our obligation, constitutional obligation to the individuals. Now, let me just say a little about the public-private partnerships that we are harnessing in Kenya. The government contributes close to 60% of the day-to-day running of health services across the country. So there's a big opportunity for public entities, private entities to plug in and contribute towards healthcare. Realizing that Kenya now is moving from lower to middle income earning country, and so the opportunities with that for business are a lot. Now with the sustainable development goals that are being launched here, a lot of people have said, oh, they are too expansive, there are many with many indicators, but I find it to be an advantage because that creates a big platform for many private companies to plug in the field of health to try and invest and improve the quality of life of Kenyans. Non-communicable diseases is one of the areas where there is a lot of opportunities. It's been neglected for years. Many of the people in our country have non-communicable diseases like diabetes, cancer, hypertension, but unfortunately they don't know that they have it. So there is a big opportunity for public entities to invest right from awareness, prevention, treatment, palliative care. It's a big expanse of opportunity. So I would welcome anybody to come and partner with government. We're trying to make their work easy by making their doing business with government quite easy. Part that businesses can play, both in making profits and also being socially responsible in terms of inclusive business practices that make sure that they not only empower the individual, they empower families, they empower communities, and the whole nation at large. The world has become a village. Things that happen in China today affect health and governance in Kenya tomorrow. So you cannot lie in your own little cocoon and expect that the issues that happen in Kenya have no ramifications and impacts across the world. They do. And when you come here, as I've noticed in this meeting, there are solutions that are homebred in China, but they can work in Kenya. They have come from India, they can work in Kenya, just need to be modeled for our country. So we don't need to reinvent the wheel because that costs us a lot of money and it is not there. So we come here and engage with guys and also offer a platform for guys to come and invest in our country because nobody has enough money. So the government needs to come and plug in. Then the other thing is, as a country, we have a lot of innovation that is going on. We have a penetration of mobile telecommunication that is just awesome, and it's a platform that many companies can plug in for their products. Finally, we have solutions that others can benefit from. We can't be selfish and just hold on. So we come for such meetings to share and to also receive.